Welcome to Between Two Ovaries, your go-to for all things women's health.
A lot of people just say like, oh, my vagina.
Yeah.
And
Yes.
that's
all
not,
of the above.
That's not your vagina.
No.
Well, it is.
We're here to cut through the confusion, bust some myths, and give you the facts straight from the experts.
You cannot still believe the amount of people that come to a gynecology clinic saying that they don't look right down there and they need something doing about it.
We're keeping it real, bringing you honest conversations about topics that matter to you.
Everything goes back to the menstrual cycle. Yes, it's a low-risk procedure, but it's not a no-risk procedure.
From periods to menopause and everything in between, we've got you covered.
So whether you're here to learn, laugh, or just listen, you are in the right place.
As soon as I said it. So, welcome back to season 3, and also welcome back to our new setup. We're very excited about it, and we hope that you guys are too. For those that just listen, because I was just thinking actually, this
Please
will
suddenly
mean
have a look.
absolutely
Have a
nothing.
little peek.
Have a quick look, because we have definitely gone up in the world. We are
Decorate.
we're on sofas. We have a backdrop. We've got little cushions.
If you are listening and you're driving, we'll just tell you it's very cream,
Shimmering as
sparkly.
well.
Yeah.
We've got pink on it. It's beautiful.
It's very Between Two Ovaries,
Yeah.
isn't it? It's on brand.
with our new mugs.
And new mugs.
and
yeah.
our new mugs. Oh yeah, so you have to look if you're not looking now.
Cheers.
And you're not driving, look.
If you're driving,
Cheers.
concentrate on the road.
And we're also just much more comfortable, so you'll hear that in our voices, even if you
Yeah.
are just listening to the audio.
It's even more like a chat, which I'm not sure is a good thing, guys.
Yeah.
I think it is. It's
Okay.
going to encourage even
It's
more
going to be nice and
tangents.
friendly, yeah.
Okay, we'll go with it then. We'll go with it.
So this is our first episode of our new season. So it is called Hyperemesis, when morning sickness isn't morning sickness. So we wanted to cover this episode because you will have probably heard of nausea and vomiting in pregnancy, which most people get, but not many people get hyperemesis gravidarum, and it is a severe form of nausea and vomiting in pregnancy, and it can have a huge negative impact on people's physical and mental health. And because it is fairly common, if you think about the fact that there's lots of pregnant women and a proportion of them will get hyperemesis gravidarum, I think it's really important that people have an understanding of it and how severe it can be. So we wanted to raise awareness about that and delve into the topic.
I think, just picking up very quickly, I think the people that will have heard of it wasn't Princess Kate, didn't she have hyperemesis?
Yes, she did.
Because I think that was very much on the news when she got admitted with hyperemesis. And I was like, oh, maybe hyperemesis will be heard about more.
I haven't heard of it before.
Yeah.
Well, that will have been quite a long time ago, really, because that was with her first baby, right?
Yeah, so how old is her
Is
first?
he like 12 now?
Maybe.
Pretty old.
So it was
Yeah.
probably when you were
You
like
guys
12.
I don't think we were
That's like
keeping up
half
with
our
the
lives
royals.
ago.
Do you keep up with the royals now?
No.
Not much.
just checking. Just checking.
I do remember that, though. It was definitely quite in the media
Yeah,
at the
I
time.
think so.
But yeah,
lot's
probably a lot
happened
of people
since then,
haven't
yeah.
heard of it either, which is, why we're doing this episode.
Yeah.
Raise
Okay.
awareness.
Yeah. Okay, so I've never heard of it before. What actually is it? Because you're saying it's not just morning sickness, it's worse?
No, so it's not just morning sickness, and I think we should also caveat that nausea and vomiting in pregnancy is also not just morning sickness.
Yeah.
Lots of people will have nausea all day or just at night time. So morning sickness is a kind of useless term.
Why do we
Is
call
it like
it
an
morning
old
sickness?
wives'
Yeah.
I'm not entirely sure, because when you're pregnant, you kind of feel sick pretty much all,
All the
the
time.
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 And I
And it's
think
kind of annoying if people think, oh, well, if you just feel sick in the morning, then why are you moaning
12
all
noon,
day?
you should be fine.
But you do feel sick all day sometimes.
and there's definite triggers for different people.
Okay.
So it's not just the morning. Some people, I found it awful brushing my teeth, which is
Ooh.
ridiculous, but because you want to brush your teeth.
Yeah.
But when you're brushing your teeth, it made me feel so sick, really, really sick brushing your teeth, and you're like, but I need to brush my teeth.
You're looking in the
So-
cycle then, because you'll be sick, so you need to brush your teeth, and then you'll be sick.
Yeah.
Then you need to brush
Although,
your teeth.
if we remember what the dentist was saying, not
you
to
shouldn't brush your teeth after
straight
you've been
being
sick.
Have a bit
Yeah.
of cheese.
Have a bit of
Have a bit of
cheese.
cheese.
But that might
makes
be
you
a
feel
trigger for
sick.
someone else.
Yeah.
Kind of do feel like though you do want to brush your teeth.
Yeah. Oh,
and there's
absolutely.
loads of triggers, like smells for a lot of people can make them feel really sick.
Yeah.
And oh gosh, so many different things.
Yes.
But that's like the key difference really. So most women, I think it's about 90% of pregnant women will get nausea and vomiting in pregnancy, but hyperemesis is a severe form of that. So it only affects 0.3 to 3.6% of pregnant women. And it's a severe kind of intractable all day nausea or vomiting. So having nausea all day is just as bad, if not worse, than having vomiting all day.
Yeah. Oh, yeah.
You don't get the relief after you've been sick, you just feel sick all day. It tends to start in the first trimester, so usually before 16 weeks you'd expect it to start. If it started after 16 weeks, you might think, oh, is it something else? We need to check it's not a different
I
thing.
do think people get labelled with it's vomiting in pregnancy, and you're like, but they're 25 weeks pregnant and they've never had vomiting. Have we thought that they could have a urine infection or they could have gastroenteritis? Because the problem is when you're pregnant, people think that you can only have pregnancy-related complications.
Yeah, exactly.
And they forget that actually you're a normal human being that just happens to be pregnant.
growing another,
And that means that you can have any of the issues that anybody else has. So when you have a headache, it doesn't just mean that you're having a stroke or it doesn't mean you could just be having a headache like a normal person. Or if you've got flu, you could just be having flu and it's not related to your pregnancy.
Yeah, just because a pregnant woman is vomiting doesn't mean it's because she's pregnant. I think is key, isn't it? Yeah. Appendicitis or lots of other things. So it usually starts in the first trimester, but then it can start a little bit later. And the key thing with hyperemesis is that it's this intractable, like all day nausea and or vomiting that affects the ability to eat or drink. You can have hypersalivation, so just constantly needing to spit. And then it usually causes weight loss or prevents you gaining weight and can cause nutritional deficiencies as well.
So it's dehydration, I assume.
Dehydration. Yeah, so it's like a really severe form of nausea and vomiting in pregnancy. It's horrible.
So it's not very common.
No, it's not very common. So the stats are 0.3 to 3.6% of pregnant women will have hyperemesis. But I think when it's diagnosed, it's usually when you're admitted to hospital. Okay. So it might be sort of slightly represented in that statistic. It might be a little bit more common than that. But the kind of definition is kind of subjective as well, isn't it? Because you have nausea or vomiting that's affecting your daily life, it's affecting your ability to eat or drink, so that might be different from one woman to another.
And like if you vomit once, even if it's self-inflicted, you feel like death.
It's
horrendous.
horrendous.
Like you actually feel like you're going to die if you vomit once. So it's that differentiating between people that are vomiting due to being pregnant, and it is really annoying, but actually you're vomiting a couple of times a day, or you've got this nausea but you can eat, you're managing to drink, that kind of thing. That's very different to somebody who is genuinely not managing to keep anything down at
just can't
all,
get on with you every day,
and is losing weight past themselves. Like that's kind of not normal, especially when a lot of times when you feel sick, you end up actually carb loading. So you put on weight because the thing that satisfies is to have something,
like
when
some
you're
bread
like,
or something.
if you're hungover, it's like you kind of just want to keep eating, like to kind of stave off that nausea. It's the same situation.
Yeah, because with just kind of normal nausea and vomiting in pregnancy, having an empty stomach can be a trigger. So it's quite good to kind of eat little bits of food if you can, anything that you can tolerate.
Well, I think the thing is as well, if you're feeling really sick, I feel like the last thing you want is like a nice nutritious salad or vegetable thing.
You want salt and vinegar crisps and
that's
what I would want.
I
would just want
bread or crackers,
biscuits,
just plain
ginger
pasta.
biscuits. Ginger biscuits, they do work. So it's not as common as nausea and vomiting in pregnancy, and it's a severe form. So I think it's really important that we're aware of it and people in the general population are aware of it as well.
Agreed.
So we've said there's like triggers obviously for just normally not feeling well and in pregnancy. Why do some people what causes them to get this hyperemesis?
So it can be due to you being pregnant with twins or having a molar pregnancy. So these pregnancies give you much, much, much higher levels of HCG. And the HCG can make you feel really unwell. Okay. So human chorionic gonadotropin is the hormone that's produced when the placenta starts to be made, when the pregnancy starts to kind of be formed.
Okay. Is that the
hormone
that's in your urine?
What's picked up in a pregnancy test. So it's right from that beginning bit. So as soon as it gets to a level where it's kind of making you feel sick, so if people are starting to feel sick really very early on, you kind of like, is this a twin pregnancy? Is this a pregnancy that could be a molar pregnancy?
What's a molar pregnancy?
Yeah, we'll
Sorry.
discuss more about molar pregnancies at a different time, because I think that's going to be a whole other episode. But it's a pregnancy that you can either have a partial or a complete molar pregnancy, and usually it's not an ongoing pregnancy. It's a pregnancy that we need to remove because it means it's got the wrong number of chromosomes usually, but it can turn into a cancer.
Oh,
The pregnancy is...
So it's something that we definitely need to discuss more in detail, but it can cause massive high levels of HCG, and that's what we monitor to make sure that people have recovered and that everything is getting better.
okay.
But yeah, we will do an episode on gestational trophoblastic disease, molar pregnancies.
Especially because
So many names.
well, especially because you guys have just been like, I'm sorry, what
is it?
And although it's very rare, it affects way more people than you think it does. So I
it's
think
really interesting, isn't it, as well? Like the science behind it is very interesting. But it is something that you produce more HCG, and if it's HCG that's making you sensitive to, or if you're more sensitive to HCG and that makes you feel sick, then if you have more of it, you're going to feel more sick.
Yeah.
So we're more suspicious of someone potentially having a molar pregnancy or a twin pregnancy if they're very, very sick and get admitted to hospital. So they'll always have a scan.
just to check
Okay.
that the pregnancy is in the right place and that the pregnancy is a singleton pregnancy or a twin pregnancy, and that it's not a molar pregnancy, basically. And it depends kind of also what you're like at the beginning. So if you're somebody who is already nutritionally deficient in a lot of things, then actually it's not going to take much to push you over the edge to make you be kind of very nutritionally deficient. So we have to ensure that we're checking all the different things in the bloods to make sure that everybody is where they need to be.
Definitely are.
Which we'll cover a bit more. I can see like your brain going like, I'm not going to say too much too soon. So we're gonna cover this. We do jump around anyway, don't we?
We do.
There is sort of more recent research that's shown that potentially hyperemesis and severe nausea and vomiting in pregnancy is caused by different genetic variants which affect how much you produce a protein called GDF15. So it's growth differentiation factor 15, produced by the placenta. And certain people have genes that mean that they will overproduce that protein. So if you have more of that protein, you get more nausea and vomiting. So it's linked with more severe hyperemesis. And it's a good thing, I suppose, because I think at the moment there are some studies underway looking at how maybe that gene could be manipulated as a new treatment for hyperemesis.
This was all in the press recently.
Yeah. I think it's all
So it was
like animal
cure
work
for
at the moment.
hyperemesis. I was like, really?
Like, amazing, let me see.
I looked and I was like, not sure that we're
It's
quite
like that
there
with
yet.
these headlines, isn't it? Like
Yeah,
cure
completely
for something.
sensationalised.
Yeah.
But I mean,
maybe
it's
in the
something
future.
in the future.
Yeah, and it's interesting to know that it's not just HCG. There's maybe another link there because it is a genetic. There is a genetic link with it. So I think if your mum has had hyperemesis, you're more likely to have it. If you've had it in one pregnancy, you're more likely to have it again in subsequent pregnancies. So yeah, interesting.
Very interesting. So how do you define how severe it is? Is there like a scale or anything?
Yeah, there's the puke score.
That is such a good name.
Puke, yeah, but it's
not spelled
P-U-Q-E.
P-U-K-E.
Okay.
There's a couple of different tools.
works
That's
kinda
the one
well.
that we know and is probably most widely used, I think.
Yeah, I reckon so.
It's like a scale, so it's pregnancy unique quantification of emesis. Emesis means vomit or being sick. So it's a sort of scale where you would ask someone like how many times a day you're being sick or how much of the day you're feeling sick.
Yeah.
All of those things. You get a number and that number will give you a category. Is it mild, moderate or severe? Which is useful because, as we said before, vomiting and nausea is very subjective.
Yeah.
So it's one person may score a 3, but actually find it extremely debilitating.
Yeah.
So it's just one element of us trying to assess how severe it is.
Yeah, I
We
feel
would
like
also take into account what the person's telling us as well.
Because some people can feel really sick without actually vomiting, whereas some people will vomit and not feel that unwell.
Yeah, but
Yeah.
if they're not eating or drinking, then that needs to be taken into account
Oh,
because people get very worried about the baby, and actually usually babies are totally fine because they're like parasites. So you can be losing weight, but the baby
It's growing.
Babies are usually growing totally fine. But we used to be very much like, feels really bad now, but we used to be, people came in, had a urine dip, and if your urine dip was clear, we were like, fine, whatever you're doing, it's working, so you're all right, go home. just like looking at like dehydration through your urine basically.
Okay.
Yeah.
But now it's a lot more kind of taking the person into
Yeah.
account and kind of how debilitating it is, how many times they're vomiting, and it's like obviously we need to take into account, are they dehydrated, what else can we do, but it's not just like a urine dip, what's in the urine dip, yes, no, in,
You can
out.
stay, you can go,
And it used to be in the
Yikes.
guidelines, didn't it? It would be like if you have 4 pluses of ketones, so a lot of ketones in your wee, then that'd be like, right, okay, you need admitting to hospital. But actually you can have 4 pluses of ketones but still be managing to eat and drink, or you can not eat or drink and be feeling sick all the time and have no ketones in your wee. So it doesn't actually it doesn't help manage the person.
No, it definitely
So we don't do that anymore.
We don't do that anymore. We've lived and learned.
Okay, so we don't do that anymore. What investigations, if someone's, you know, in hospital feeling really horrible, what would you do to find out if they do or don't have?
Yeah, so we do a urine dip
Okay.
as like a baseline, and anybody who walks into the hospital that is of childbearing age has a pregnancy test and a urine dip. That's just kind of a routine.
Yeah.
So we would always do that to kind of have a look from that side, and you can also pick up other things, because as we've said, yes, you might be vomiting and you're pregnant, but you could also have a raging urine infection. So it's good always to kind of just check
everything.
and then we would check for blood count, to make sure that that's okay, and then we would check the UNEs, so that's your kidney function, because sometimes you can be so dehydrated that your kidney function goes off. So we would need to kind of make sure that we're looking after your kidneys, because we don't want to insult them if we
don't want to call them horrible names.
No, because it's not a good idea to be running like a low AKI, so an acute kidney injury. You want to be hydrated basically. You will also do your liver function tests, and these can often be abnormal if people are vomiting. Also with the UNE, you check your potassium, and potassium can be abnormal if somebody's vomiting as well. Very much like people that are suffering with bulimia, anorexia, their UNEs can be off as well, not just from dehydration, but because they've kind of knocked their sodium off, their potassium is high. So when you're thinking about like fluid replacement or food replacement, you need to be having a look at everything, not just kind of a baseline UNE.
You can get a really low potassium if you vomit a lot, because there's a lot of potassium chloride in your like digestive juices. So if you vomit a lot for whatever reason, you can get low potassium, and if your potassium goes past a certain point, that can cause like heart arrhythmias, and it can be quite life-threatening. It's not often that it gets to that point, but it's important to check if someone's been admitted because they've been vomiting a lot.
Yeah, we definitely need to know these kind of things. And ensuring that LFT, so your liver function, if they are extremely off, can make you quite unwell, as in disorientated. Your sodium, if that goes low, can make you disorientated. So we need to make sure that we kind of know what the baseline is, but also that when we're replacing it adequately and slowly as well, not too quickly. So just kind of keeping all these things in mind, basically.
So how do we help these people? Is
Well,
there treatment?
There is another test that often gets done as well before we say how they get managed, which is quite important because it is quite commonly done and then sometimes misinterpreted. So when someone has hyperemesis, when someone's pregnant, they have high levels of HCG, which we talked about before. And HCG is the same kind of shape as something called thyroid stimulating hormone, which is a little hormone that tells your thyroid to produce thyroxine. So if you're pregnant, then that will be telling, the HCG will be telling your thyroid to kind of overproduce a bit too much thyroxine. You don't have any symptoms usually. This is just going on in the background while you're pregnant, and it doesn't usually give you symptoms of high hypothyroidism. But if someone does a blood test, they'll see that your thyroid function looks all over the place and might be thinking, oh, well, this woman's pregnant, she's got hyperemesis, but she's also got hypothyroidism, and we're going to have to treat that. Which you don't.
All the things
Yeah. So the kind of message is that really they shouldn't be done. You shouldn't be getting your thyroid checked while you're pregnant unless you have thyroid disease or the person's suspicious of you having thyroid disease from your symptoms. But women who are pregnant will not have any kind of clinical signs of hypothyroidism. But if you do the blood tests, it will look like they have that going on. Yeah.
Just to be aware of.
Yeah, that feels like a little
trips people up
curveball.
sometimes, doesn't it? I've definitely been tripped up by it before as well.
Because we used to do it. Because we'd be like, is vomiting caused by like a thyroid condition rather than vomiting caused by pregnancy. So we definitely used to do that a lot more than we do now.
Yeah.
I'm going to go a bit rogue here. Remind me what the thyroid does. Because it's a bit of the brain, isn't it?
No.
Is it not a gland?
It's in your
Oh,
throat.
okay.
Yeah. But your pituitary, which is in your brain, tells your thyroid to produce hormones.
It's all connected.
Yeah.
Yeah.
And what does it do?
So it produces thyroid hormones,
Yeah.
which are like iodine-based hormones.
Okay.
And they control lots of different functions in your body. So if you have... It's a quite nice way of thinking about it is if you have too much thyroxine, you get things like palpitations, sweating, vomiting, feeling very energetic, weight loss, hair changes.
Anxiety, like manic.
Whereas,
kind of...
Yeah, craziness.
Okay, so she's very important.
Yeah, and if you have like low
But if you have
hormone,
hypothyroid, it's the complete opposite to that.
Hypo, low.
Tired, overweight, slow, hair loss again, depression, that kind of thing, feeling cold all the time.
Okay.
So your thyroid function should sit somewhere between those two extremes. So it's a very important gland.
It helps with all of those things.
Yeah.
So all of the important things.
So can we jump back
Management.
to the
back to the treatment. So the good thing is there's lots and lots of different treatments for sickness, nausea and vomiting in pregnancy. But the bad news is that often it doesn't completely get rid of those symptoms. Okay. So it's a case of kind of starting with something like a tablet, trying a few different tablets. We'll go into the different tablets that you can have, trying to get to a level that you can function normally. But it's quite difficult to completely get rid of the nausea and vomiting, I think.
I think it's like, it's not a one size fits all, which we say this with a lot of things, which means that it's a bit of trial and error. Yeah. And some people, as I said, like taking a tablet would make them vomit, so they wouldn't be able to take a tablet. Yeah. So there's different...
And it's not going to absorb if they're vomiting it back.
No. So there's like different things that you can take. Also, just to mention, it's worth mentioning that when you're taking things in pregnancy, these haven't been tested on people that are pregnant, but we have used them so widely that we know that they're safe in pregnancy. So there are some people that would be like, I don't want to take anything because I will be worried about
what it's going to do to the baby.
But we know that we've used these so many times that we're happy to use them in pregnancy.
Yeah, there's so much data out there that we know that they're safe in pregnancy, but it's just that there's no official... This is safe in pregnancy.
Because they're never going to do the
say that,
from the
do
drug
they?
companies.
So what sort of like tablets?
So you've got drugs that work on histamine receptors, so antihistamines basically, and that Zomvia is one of them. Also, cyclazine is a really common drug. You can use different types of drugs, so you can use different classes of drugs. So that's one, like histamine antagonist, which, so if you ever get travel sickness, have you had travel sickness?
Yes.
So the kind of over-the-counter travel sickness drugs are basically histamine receptor antagonists. Okay. So they give you a bit of a dry mouth and hopefully help you vomiting in the car. And then you've got others as well. So there's lots of different classes of drugs. We'll mention them, I suppose, because it's relevant. But you've got like dopamine receptor antagonists, so like metoclopramide and domperidone.
So these help with gastric emptying.
Yeah.
So you're kind of putting things through your digestive tract a little bit faster.
Okay.
So they're not sat there making you feel sick.
Okay, move on.
Yeah, move on.
Yeah, so they all work in different ways. And then you've got serotonin receptor antagonists like ondansetron, which works in a different mechanism. And then you've also got phenothiazines, which are the most commonly used one is prochlorperazine. So they all work.
Long words today.
I know, right?
I feel like you're speaking a different language when you say drug names. I'm just here like, you are?
I mean, I think the overwhelming thing from this is that there are lots of different medications. They work in lots of different ways. So if the first one doesn't work for you, then actually it might work when we add in something else.
Yeah.
It might work when we're peppering them throughout the day, because we've said before, like, when someone's just taking paracetamol once as a one-off, it's not going to help. Whereas if you take paracetamol 4 times a day, if you take ibuprofen 3 times a day in between, if you go, if you're adding things in for pain, you can do the same for vomiting.
Okay.
Yeah.
So you don't have to just have one tablet that's not working.
Yeah.
You could be like, right, what I can do is use an ondansetron melt, because that means I don't have to swallow a tablet.
Yeah,
and
it just dissolves under your tongue.
Dissolves under your
Okay.
tongue.
Great.
So that's great. And then I'll have something to eat. And when I've had something to eat, I could take a tablet then, because I will feel okay for a bit.
Yeah.
And then so you can like work it out through the day.
Build it in.
Yeah.
Okay.
And I think it's difficult because you're a bit like, well, I'm vomiting, nothing works, and I can't take anything.
Yeah.
But if you break it down, then we can make this better.
Yeah.
So it's just a bit like, we need to just have a think, go back to basics,
Yeah.
start
See what
from the
works for
beginning. Let's try and get you something so you can get something to eat or something to drink, and then work other things.
Yeah, it
That's
is a
nice
trial
that
and
you
error
can
thing.
tailor it to people like that.
Yeah.
It's hard, isn't it? Because like Nick said, lots of people might be like, right, well, I've tried this tablet and I'm still vomiting, so anti-sickness tablets don't work. But it's really important then that you know that there's different ways that we can kind of interrupt that nausea pathway. So it's worth trying other things.
Injection?
Yeah. So, and that's what we have to do sometimes. So, yeah, I've just said that you might have this melt and it's absorbed, and therefore you don't have to kind of take a tablet and swig it down. But actually, that might even be inducing for vomiting if you're putting something in your tongue.
And I'm sure it probably doesn't taste.
So, yes, there are injections, which obviously you would be having in a hospital, not at home, but they can just break that cycle. So if we can get on top of things with the injections and then get going with the tablets and getting you something to eat and drink, then it's just a way of kind of stopping that cycle and getting things kind of into a better...
stopping you vomiting for long enough for you to keep some tablets down for you to then go home.
Yeah.
If you're able to.
Yeah.
But some people will require admission, some people will require IV fluids through a cannula to rehydrate them.
Wow.
Yeah.
Okay.
Like we said before, most of these drugs we know are very, very safe in pregnancy. There's a recent study that showed ondansetron, which is really effective. So ondansetron's like really, really good at stopping nausea and vomiting. And then there was a study that showed that, so you know cleft palates?
Yes.
Yeah.
So there's a teeny, tiny increased risk of cleft palate if you take ondansetron in the first trimester of pregnancy. And when I say teeny tiny, it increases from 11 in 10,000 pregnancies to 17. So it goes up a teeny tiny amount.
Wow, that is,
Yeah, but it's enough that there was a big warning released about it, and we have to tell pregnant women that you're allowed to take it, but you know, if you do, there's this teeny tiny increased risk of cleft palate. So for some people that'll be like, no, I don't want to take it, but for others it might be like, well, I've tried everything, this nausea and vomiting is so bad, I want to try it anyway.
Yeah.
And it also makes you constipated, which I didn't know. And this isn't from personal experience. It was when I was when I was looking at notes for this. I definitely didn't know ondansetron causes constipation, but apparently it's quite a like it happens to most people.
And then when people are admitted, they should see a dietitian as well. Well, it'd be great if everybody could see a dietitian, but it's just not going to happen in the system that we work in. But we try and get people to see a dietitian to kind of advise them about what might be best to eat and drink. But we know, like, little and often, keep a water bottle with you. I know we always laugh that I'm always like, this is the most hydrated, generation in the whole world.
Not a fan of the emotional support bottles, aren't
I? Don't get it. But anyway, with regards to when you've got nausea all the time, having a water bottle and just taking sips actually means that you're getting something in.
Yeah.
Even if it feels like you're not, you probably are still
Getting
retaining a bit of that hydration.
Yeah. And the dietitian will also make sure that you've not got any other deficiencies that we need to replace, like a whole screen of different things that could need replacing, and we should replace them if needed.
And that brings us nicely to thiamine as well.
Yeah.
So thiamine is vitamin B1.
Yep.
And if you've been vomiting for quite a long time and then you get rehydrated quite quickly, especially if the fluid that you rehydrated with has got dextrose in it or sugar, it can cause this neurological emergency, which is called Wernicke's encephalopathy. Where basically like, you're severely depleted in vitamin B1 and then you can get symptoms like confusion, you can have like eye jitteriness, you can be unstable on your feet, and it can be a neurological emergency. So when someone is so severe that they've been vomiting for a while, requiring admission, we always give thiamine to prevent that happening.
Okay.
Yeah, so
It's
not everyone
exactly
gets
the
it,
same
but-
as what happens when people are alcoholics and they stop drinking and they're not topping up where they need to be. So when people are admitted with kind of fits and seizures because they've stopped alcohol, then a lot of them will be thiamine deficient.
Yeah.
So it used to be kind of when people were admitted to the medical wards, to be like, have you prescribed like the thiamine? Have you prescribed? Like it's just like a normal thing that you do.
Yeah. So yeah, pregnant women are often deficient in B1 if they've been vomiting as well. And then there are other drugs that you might need. So if you think about if you're retching a lot, you might get a bit of like reflux irritation around your esophagus, and that can be really painful. So often giving someone Gaviscon or omeprazole can be helpful for that. Rennies, yeah. People often are trying these things at home before they come in anyway, but you know, if you can give it through a drip if you need to as well.
Yeah, so if you're not keeping anything down orally, we can give these through a drip. And you also need to be really careful about, if you're not managing to keep things down orally, that's fine to a certain extent, but if you're somebody who's epileptic or somebody who is on medications that they need to take for another condition,
didn't even think about that.
Yeah, we need to have a rethink about how we're going to get medications absorbed, because there are different ways that we can take medications. So it's prudent to ask if they're on any other medication.
I was just going to say birth control, but they're obviously not going to be on birth control.
We hope not.
Yeah, although I guess you could have someone who doesn't want to be pregnant and is planning a termination and might still actually be taking their contraception, potentially, if someone has, an implant in or something like that. But yeah, very unlikely. So yeah, you've got tablets, which can be given as tablets or often can be given injections as well. If you can manage your nausea and vomiting outside of the hospital, great. If you need to come into hospital, you might just need to come in for the day, so you can be kind of rehydrated. As Nick said, you could have an injection of the anti-sickness medication, and then if you feel well enough, you can go home on the tablets. Or you might need to come in and stay in for a few days, and that happens as well.
I feel like if you're feeling really unwell and you can manage it at home, you would want to be in the comfort of your own home.
Yeah, if you can.
If you think when you're in a ward, like, it's like buzzers will be going overnight, the lights are on and off, like, it's definitely not an ideal situation.
But it's people who like might need their medication giving in a different way. Or if you've lost weight as well, then that's an indication that you need to be in. Or if you've got any of those electrolyte abnormalities, we would want you to be in hospital so we can make sure that you get better.
Yeah, we don't want you having other things like a renal failure or a heart event because your electrolytes are all over the shop. Like,
and you're just sat at home.
Yeah, not ideal. Not ideal.
Scary.
The other thing that sometimes people do need is a short course of steroids, because steroids can get you up on your feet with regards to wanting to eat and drink, and help with nausea. So they're given quite often when people have chemotherapy, to kind of bolster you wanting to eat and drink and kind of make you feel a bit better. The only issue is obviously that you don't want to take steroids long term if you can help it, because if you're taking steroids, your body then forgets to make its own steroids. So you need to wean off steroids or just have a short course. Steroids, again, we can give IV, so you don't just have to have it orally if you're not able to take anything oral.
Yeah, and you can have, steroids are often like a last resort kind of drug. Like we want to try everything else first because everything else is probably a little bit safer. But then you can be on other anti-sickness medications and steroids as well, and it's just getting to a point where your symptoms are manageable.
And
if you
can keep them down,
then you can wean down the steroids. If you do end up being on steroids, it increases your risk of getting gestational diabetes, which is diabetes in pregnancy. So you'll end up just needing a test for that later on.
All of the things, all of the repercussions.
And then just sort of like if your hyperemesis carries on into the second trimester,
which then people with proper hyperemesis tends to just kind of carry on, which is awful. But we need to keep an eye on these. So you imagining that there's ongoing weight loss, and we've said that there's like the baby's like a parasite, so on the whole that they're fine, but actually if you're continuing to lose weight and you've got more and more deficiencies, then we'll need to just scan the baby and make sure the baby's growing.
Because they can have low birth weight babies, but some extra scans.
This must be like really horrible to go through when, like, you know, pregnancy is meant to be such a nice happy time, which I feel like it's always painted as this lovely picture, maybe it's not, but like this must really make you wonder what you've done.
It definitely has a massive negative effect on people's mental health. Because if you imagine, say you planned a pregnancy, you're excited, you're pregnant, and then all of a sudden you feel worse than you've ever felt in your entire life. You can't eat or drink, you can't get out of bed, you can't go to work.
You're anxious about the baby.
You're anxious about the baby.
Yourself.
You feel just physically and probably emotionally drained. It would just be an awful situation to be in. So that's something that really needs recognising, and people who have this need a lot of support. There is a website called Pregnancy Sickness, which we'll put a link to at the end. They've got lots of resources for like mental health support for people going through this. But it's just being aware, I think, like that if someone's saying they've got really severe vomiting in pregnancy, don't just assume it's morning sickness.
Yeah.
Which we've already said is not morning.
Yeah.
It's difficult as well because obviously some people will work through their pregnancy until a certain point. But if you're not being able to eat and you're throwing up all the time,
you can't go to work.
You can't
go to work,
No.
especially if you've got a job that
Which
you need
makes
to
you,
be
you've
like,
just kind of said that
here,
though,
there
which
and
makes you feel
everywhere.
even more kind of guilty in a sense, isn't it? Because some people are like breezing through the pregnancy, living the best
Yeah.
life, showing the bump off, and you're just like, feel like death.
Sat in bed, yeah.
Yeah, and social media will tell you that you should be enjoying your pregnancy. And
Oh, you're in the
you should
second
be looking
trimester
great.
now.
It's the best
You
time
should
to
be
be
blooming.
You've got your
Everything's
glow.
great. Yeah.
And then actually you're vomiting past yourself in and out of hospital, not able to go to work or see your friends. And then there's also this, like, you're aware that you're going to have a baby, so your life's going to change, but it's changing so drastically from the beginning of the pregnancy. It's really hard to get your head around.
Yeah.
So people actually end up having terminations because this is so bad.
Yeah.
Oh gosh.
Yeah.
So I do feel like I can totally get it though. As we said, if you vomit once or twice, like you feel like you're gonna die.
Yeah.
If you're vomiting all the time, you won't be able to see like a light at the end.
No. I mean, imagine the worst hangover you've ever had, but it's that every day and you don't know when it's going to end. It would just be like just really awful for your mental health.
So people really do need support.
Yeah,
And
I was going to say, is there some
and if they've
support
kind
out
of like said about potential termination, then we really need to make sure that that's the right decision for them as well. In
And
this
that they've
situation.
actually, had a good go at really optimising the medications that are available and had steroids and everything like that if they can. But yeah, if that is, if that's the right decision, then that is the right decision for them.
Yeah.
But you just want to make sure that everything has been tried to make the situation better before that is the only eventuality.
Yeah. If you did have hyperemesis, decided to terminate because you couldn't, if you then got pregnant again, are you definitely having it again? Are you more likely to? Like
You are likely to
likely.
have it again. So it's tricky. Not guaranteed to be exactly the same.
Yeah.
But you are likely to have hyperemesis again if you've had it before. There is I suppose, if you don't know you're going to get it and then you get to 6 weeks and you suddenly feel awful, potentially in a next pregnancy you could start anti-sickness earlier in the knowledge that you might start to feel
and you
poorly.
might have kind of figured out what will help you.
Yeah. But it's still very
It's one of those
difficult.
things that puts people off getting pregnant ever again.
Oh, I bet.
Obviously didn't put Kate off though.
No, it didn't.
I know she's got how many now?
3?
3.
Eleanor on there.
How many did the royals have?
I'll let you know later.
Yeah, do a little bit of research on that one.
Definitely.
On the complete flip side as well, because we are talking about how these medications are safe in pregnancy, but a lot of health care professionals are a bit wary about even giving anti-sickness to pregnant women.
Yeah.
So I did see someone once who was planning a termination, and she was about 9 weeks and had really severe nausea and vomiting in pregnancy, and went to her GP who wouldn't give her anti-sickness because the GP said that nothing's safe in pregnancy and you're going to have a termination anyway, so you don't need it. And then she got so unwell that she ended up needing admission to hospital, so we were able to do that for her. But it's just crazy that like you can be from one extreme to the other. The knowledge about what is safe and what isn't safe in pregnant women needs to get better so that they're able to have the treatment that they're like able to have.
I think it's
a bit more
literally
accessible
a
for the
blanket
women
policy for a
themselves.
lot of people. You're pregnant, so therefore it's a no.
Yeah.
For everything. Whereas I think because we work at a women's hospital and we see this all the time, we're maybe a lot more liberal than others.
This is why we do this kind of
Yeah.
Absolutely.
Give people anti-sickness,
Give them
please.
anti-sickness,
Whether
especially
they're having a
if they're thinking about
termination or not,
termination.
flipping it.
Yeah.
Like you're already in turmoil because of all of the things, and then we're not allowed medication that'll make us feel better at least.
I know.
Yikes.
And I think that like headspace is really awful because it might be a wanted pregnancy that then you don't want anymore because not just that you don't want it, you can't cope with it because it's so debilitating.
Yeah.
And the actual like the thought process behind that and the emotions will be so difficult.
Yeah.
So these people really do need a lot of support to get through that.
100%.
Yeah.
100%.
I think that's most of that we wanted to cover.
Yeah,
I think
time
we've
for
got some
questions.
missing
Right.
questions. Let's have a look.
You go first.
So,
I can see them.
Spoilers.
we're not used to sitting like
it's nice though.
this. So, question. What warning signs mean I should seek urgent care for HG? So, dehydration, inability to keep fluids down.
Yeah, so the worry is that you become very dehydrated and you can get electrolyte abnormalities. So If it's been days and you're not able to keep any food or drink down, if you are not passing urine, or if you're only passing little dark bits of urine, or if you're feeling dizzy when you stand up, all these things are kind of signs that you're quite severely dehydrated. So you would need to go and be assessed.
Yeah, I
see
feel
you
like
can
if
have
you're
any.
worried, seek medical help. Like, I don't think people are going to be like, oh, you're really not that dehydrated.
No.
Like, if you're worried, then go and see
Go in.
somebody about it. And we can reassure you and say, look, this is rubbish. We totally get it, but you're doing really well. Like, you're clearly managing to keep on top of things. And would you like an anti-sickness as well?
Yeah.
And
And it might be a case of you just need to stay in hospital for 6 to 8 hours, have some fluid, have rehydration, get some anti-sickness on board, and then you'll be able to go home. But if, I think it's important, if you're feeling nauseous and starting to vomit, get help then, because that might prevent you getting so dehydrated and unwell that you need admitted into hospital.
By HG, I meant hyperemesis,
Hyperemesis.
but I can't remember what the last
Gravidarum.
what its second name is. Gravidarum.
his full title, please.
Another question is, as a partner or a friend or family member of someone who's suffering with this, what can people do to try and help?
I'm just laughing there, by the way, because I was like, what's his full title? Because
Yeah, it's a man,
him.
he's a problem.
Because he's a total problem, so it's definitely a him.
What's his second name?
Yeah, his second name. What could you do if your partner or friend is suffering from this? Just kind of look after them as you would if somebody was unwell.
Yeah.
And it's not going to be over in 48 hours. I think that's the thing. It's going to take a long time. If there's anything that they fancy, try it. So if it's suddenly that they want to try, I don't know, a plate of chips, then fine. Try a plate of chips.
Yeah.
Get to the shop, get some chips.
And maybe try and help them avoid their triggers. For some people, it's the smell of the fridge. So if they need something from the fridge, get it for them.
Yeah, maybe don't be eating tuna.
Yeah. And just be really kind and compassionate.
Yeah, be mindful and fill the water bottle up so they've got their emotional support water bottle with them all the time.
For emotional support water bottle.
Yeah.
Another question: how much weight loss is dangerous during pregnancy? Is there
we would be
1%
concerned about more than 5% of your pre-pregnancy weight. So that would be something that would trigger, do we need to think about admitting you to hospital because you've lost weight because of the nausea and vomiting. But that being said, it's not the only trigger that would cause you to be admitted. It's just that is a number that we can kind of use. And if you do lose weight, then eventually can start eating again, you are at risk of electrolyte abnormalities, something called refeeding syndrome. So you'd have a nutritionist, a dietitian in the hospital helping to prevent that from happening.
Yeah.
But 5% is the...
Yeah, like a little cut off.
Yeah.
Because realistically, we don't want you to put on loads of weight in pregnancy either.
Yeah.
And so I think kind of getting very concerned about staying pregnancy the same weight is not really an issue.
Yeah.
No.
And for people that started their pregnancy overweight, then it's a good idea to try and remain pregnancy neutral so you don't put any weight on.
Yeah.
Which I know is a bit of a different topic, but getting kind of stuck into, oh my gosh, I've lost a pound. That if you weighed yourself every single day over a week, you'd probably be maybe 5 pounds different
Yeah,
each
all over
day.
the place.
Yeah.
And it's just the same, isn't it? Well, when you're pregnant.
Yeah.
So obviously losing weight past yourself is really not a good place to be in, but losing a bit of weight is not the end of the world.
Yeah.
Okay. And then our last question, and I guess we sort of touched on this a little bit there. Is there anything people could try and do before pregnancy to prevent this?
No.
No?
No.
There's no point just popping the anti-sickness meds just to
No,
see.
because they
No.
work while you're sick in a
Yeah.
sense. So I
Only
wouldn't
take them if you need them.
Okay.
Unless
But there's no way of knowing that you're going to get it and how severe it's going to be, really, unless you've had a pregnancy before and then you've got an idea of how it could be.
Oh gosh, but when you could feel that impending doom.
Yeah, just that
like
wait
if
and
you've
see
had
wait
it
and see.
before and it starts again, you'd be like, oh,
I
you
know.
can see why people would end up
Yeah.
having insemination if they know that if there's somebody who's gotten it from 6 weeks pregnant until they've given birth at 39, 40 weeks.
And they know
That's
it's
a
going
lot
to be
of weeks.
another.
Yeah.
It's just so much of your life.
Yeah.
But yeah.
Some myths as well. So on that note, that hyperemesis only happens once and it won't come back.
Yeah.
No. Yeah, unfortunately. It probably
it's
will
also
happen
not-
in next pregnancy.
But it's not guaranteed.
It's not 100%, it's not guaranteed. You'll get it.
And a lot of people like anecdotally say that it's not as bad in subsequent pregnancies, but that also could be because they know how to manage it better and can get on that a little bit earlier.
Yeah.
But yeah.
I've definitely met people that have said it is just as bad.
Yeah.
And it's, not in a good place.
This feels like such a classic women's health myth. There's nothing anyone can do. You've just got to put up with it.
Yeah.
Yeah, not true. As we've explained, there's lots and lots of things that you can
Just chill out
take.
and have a
All
ginger
these
biscuit.
medications. Very, very long words. Well, on that note as well, that ginger and crackers will stop hyperemesis.
They won't stop, but these things will help. They can help. And if, so your ginger biscuits, your kind of, some teas might help.
Any
There are-
excuse for a ginger biscuit.
Yeah. I'd have a ginger
It does
biscuit.
help a little bit, but I think it's really key that if someone's coming in with hyperemesis, then giving them a ginger biscuit isn't going to make them feel better.
Yeah, that's not the medical
It
cure.
might be one part of like the bigger picture when they can eat and drink again.
Very true. And also NHS ginger biscuits don't really taste of ginger. So I'm
No,
not
they just
sure
taste
that-
like
the
sugar.
stem ginger
They just taste
ones
of
from
biscuit.
Lidl.
Like,
Stem
Generic.
ginger
And then
covered
do
in
really
dark
nice
chocolate.
ginger ones as well.
delish.
I think that's us.
Yeah.
Great.
Yeah,
So,
brilliant.
first episode in our new setup.
I
So
love this new
comfortable.
setup. It's so nice.
I feel so comfy.
I don't think I've even moved. I've
We
just been
feel,
like,
I feel we can chat so well.
It's nice being able to like look at everyone.
Yeah,
See
yeah.
on the table I was a bit like side eye, whereas this feels
it's beautiful.
Yeah,
I
we
like
were just
it.
side on. So, guys, you can see this side of ourselves.
It's so
view.
different. Brilliant. Okay, so a quick disclaimer. Everything we've discussed are our own opinions and are not affiliated with where we work and shouldn't be taken as personal medical advice.
Yeah, we hope you've enjoyed the episode. If you have, do remember to leave us a review wherever you get your podcasts.
And by giving us that 5-star review, it pushes the podcast out to as many people as possible. We wanted to break barriers, bust myths, and just give out really good information.
Yeah, and we want this episode and the entire podcast to reach as many people as possible. So if you want to be part of that ripple effect, then hit the like button.
Yep, and make sure you're following us at Between Two Ovaries on all of our platforms and engaging with our content.